At the beginning of 2021, there was a lot of uncertainty surrounding COVID-19 and what was next.
3 weeks of cases on the rise, and Comanche County has more than 100 active cases, while surrounding counties are only seeing single-digit numbers in cases.
We have seen an increase in the last couple of days of patients that we've actually admitted to the hospital.
Throughout the year, information changed, whether it was the masks, social distancing guidelines, or the new vaccines.
Masks are not going to be required. By law, Senate Bill 658 means schools cannot require masks. Masks will be optional, and we want anybody who wants to wear a mask to wear one. We even have free masks for any staff or students who want one.
We all want to have our lives go back to as normal as possible and maintain that. So again, we want to urge everyone to please get vaccinated and follow other mitigation efforts as needed.
So if someone is fully vaccinated 14 days after becoming fully vaccinated, they will not have to quarantine.
It was important to us to be a part of the conversation and sharing the facts.
When it comes to vaccination rates, Oklahoma is ranked in the bottom 10 compared to the rest of the country.
State Health Department data is showing a disparity between rural and urban communities when it comes to COVID-19 cases and deaths.
From the data collected statewide, 65.9% of people receiving the vaccine are white and only 2.7% are black. The other races represented were Asian, American Indian, and other, which were all less than 4%.
We did the research and brought our viewers the latest on everything pertaining to COVID-19.
Phase 3 for the vaccine rollout in Oklahoma opened up earlier this week.
Meanwhile, the Oklahoma State Department of Health is working to make sure everyone who wants to get a vaccine can get access by offering a Spanish option on the portal.
Dr. Jeff Hammond says he's gotten a number of calls from people asking about the animal version of the medicine. He believes people should refrain from taking it.
When it's not approved for use, then you're really taking a risk on yourself by doing that.
We started an on-air campaign geared to getting the answers to the tough questions about COVID-19. We called the segment COVID Questions and encouraged the viewers to submit their concerns.
We're continuing to answer your COVID questions.
You know, with this new guidelines, it's also raising questions on masking up. For people who are fully vaccinated, do they still need to wear a mask?
Yes, please. So again, with any vaccine, nothing is 100%. So yes, we want people to continue to wear masks and to continue those mitigation strategies.
We worked closely with the health departments for Southwest Oklahoma to get the answers that affected our audience. So we're going to tackle a few emails that we've gotten specifically on questions regarding the vaccine and vaccination efforts. One of those questions was the vaccine doses, and if they are used, all of the doses that y'all are given, if they're all used, or if there's ever any time whenever there are doses unused that are wasted or expire, how do you all make sure that they are used, and how do you make sure that they're never ever expired?
So we work hard to make sure that our vaccines remain viable and that we use them within the allotted amount of time. Pfizer has a 5-day shelf life once we pull it out of ultra cold. Moderna is a little bit more sturdy, I guess you could say, as once we pull it out of the frozen state, it will last for 30 days. So far, we've not wasted any vaccine.
The most important thing was making sure that facts were presented to everyone in a way they could understand.
The vaccines that we have available, Pfizer, Moderna, and Johnson & Johnson, those seem to be holding up pretty well and providing pretty decent protection against this virus. But we have to recognize that all 3 of the vaccines, none of them are 100%, none of them are a cure.
We provided local and critical information. We did this through our newscast and digital platforms, and these stories dominated our coverage. As a station, we say you can count on us. And in 2021, we made sure the people in Southwest Oklahoma could count on us through COVID Questions.